If you are suffering from periodontitis or gingivitis, and want to learn the best ways to treat it, you have come to the right place. Be sure to check out the entire video so you don't miss our tips and tricks. What is periodontitis exactly? Periodontitis is the most common form of periodontal disease, affecting approximately 75% of all Americans over the age of 35. This disease affects both sexes equally. It is caused by inflammation and infection of the gums and is defined by bone loss around the teeth. Signs may occur as early as adolescence, but due to its progressive, cumulative nature, the disease is often diagnosed in the 4th to 5th decade of life. Over time and without treatment, the infection begins to erode the jawbone that supports the teeth. The erosion weakens the ligaments, attachments, and loosens the teeth, which may eventually fall out on their own or need to be pulled out. Deep pockets that are filled with plaque can contribute to a foul taste in the mouth and are very difficult to clean. As the disease progresses, the exposed root surfaces of the teeth become very sensitive to hot and cold. Furthermore, the exposed root surfaces lack protective enamel and are more prone to developing cavities. Types of periodontitis. There are 5 types, although chronic periodontitis is the most common. Here is a brief description of each. 1. Chronic periodontitis. This form involves periodontal pockets that gradually form. It is further classified into localized or generalized forms, as well as mild, moderate, or severe amount of destruction. 2. Aggressive periodontitis. This form involves loss of periodontal attachment at a rapid pace relative to the patient's age. It is further classified into localized or generalized forms, as well as mild, moderate, or severe amount of destruction. Often it is seen in adolescence and may run in families. There may be an underlying immune system defect involved. 3. Periodontitis is a manifestation of systemic disease. Patients with certain blood diseases, e.g. leukemia, or genetic diseases, e.g. Down syndrome, are more likely to have periodontitis. Often this is due to the body's decreased ability to fight infection, immunosuppression. 4. Necrotizing ulcerative periodontitis, NUP. This form is associated with a rapid onset of pain and bone loss, ulcerations of the gums, and bad breath. Malnutrition, psychological stress, smoking, lack of sleep, and overall lack of ability to fight infection are contributing factors. NUP was called trench mouth after it was seen in soldiers returning from the trenches of World War I. 5. Periodontitis associated with endodontic lesions. When a tooth is infected and requires a root canal, or endodontic therapy, bone loss can occur at the tip of the root. Symptoms of periodontitis. During the early stages, periodontitis is asymptomatic. Signs of disease during this time may resemble those of gingivitis, bleeding, red gums, and bad breath. As the disease progresses, symptoms may include loosening of the teeth that ache when exposed to temperature changes, sore, swollen gums that bleed easily, pain when touching the gums or teeth, shiny, bright red, or reddish-purple gums, bad breath that does not go away after brushing and flossing. If left untreated, symptoms of periodontitis will worsen over time. What causes periodontitis? Periodontitis is caused by the formation of plaque on the teeth. Over time, the plaque hardens and turns into calculus, tartar, that cannot be removed by brushing and flossing. Bacteria that live within the plaque and calculus infect the gums. At this point, the disease is termed gingivitis, infection of the gums. However, if the plaque and calculus remains on the teeth of a susceptible individual, the disease progresses and becomes periodontitis, infection around the tooth. Certain plaque bacteria produce toxins that erode the bone. As the bone erodes, the gum tissue follows it and deep pockets form between the teeth and gums. These bacteria also enter the bloodstream, where they can spread to other parts of the body. Hormones may also play a role in the progression of periodontitis, especially in pregnant women. Medical conditions, such as diabetes and heart disease, have been proven to play contributing roles to periodontal disease as well. Factors that may increase one's risk of developing periodontitis include poor dental hygiene, smoking, weak immune system due to illness or drugs, poor nutrition, family history of gum disease and/or periodontitis, tongue or lip piercing. Diagnosing periodontitis. If you are experiencing symptoms of periodontitis, you should contact your dentist for a checkup. Your dentist will ask you questions related to your family medical history and symptoms. An oral examination of your teeth, gums, and supporting bones will take place. During this exam, your dentist will measure the depth of the pockets in the gums. X-rays will be taken to check for bone loss. How to treat periodontitis and gingivitis. Natural herbal remedies for periodontal disease are usually affordable and can be used at home. With natural remedies for gum disease like spearmint, peppermint, or tea tree oil, periodontal disease can be effectively addressed. These natural remedies for periodontal disease are effective because they are able to get into the nooks and crannies of the tooth and gum line, where the bacteria is hiding. These oils are antibacterial and are not easily washed away like most mouth care products. They remain in constant contact with infected areas, therefore battling the source of the problem, bacteria. This type of remedy should be used alongside of any of the above treatments or as a preventative measure. Salt. Add 2 teaspoons of salt to a glass of lukewarm water. Swish a mouthful of this solution around in your mouth for 1 minute. Spit and do it again. Follow this treatment 2 or 3 times a day. Oil pulling. Swish a mouthful of organic, unrefined coconut oil or sesame oil around in your mouth for 15 to 20 minutes. Do this before brushing your teeth. Holy basil. Mix 1 teaspoon of dried and powdered holy basil leaves with enough mustard oil to make a paste. Rub this paste on your teeth and gums and brush gently using a soft bristle toothbrush. Do this 2 times a day for several weeks. Turmeric. Turmeric can easily kill the bacteria present in the gums as well as relieve pain and inflammation. Curcumin is the active ingredient in turmeric, and it has potent anti-inflammatory and antioxidant properties. It also promotes oral health. Use turmeric powder to brush your teeth and gums using a soft bristle toothbrush. Do this 2 times a day for a few weeks. Guarana. Wash some tender guava leaves. Chew the leaves thoroughly, then spit them out. Do this on a regular basis to stop bleeding and reduce the risk of pus forming in the gums. Tea tree oil. Apply tea tree oil in the form of the gel using a toothbrush twice daily for several weeks. So home care for periodontal disease can be effectively pursued with the advice of your dentist and the right selection of natural remedies for gum disease. The key to success is to be consistent in dealing with the root of the problem, bacteria.